As more and more kids turned up in emergency rooms in the middle of having a mental health crisis, HealthOne doctors realized that Colorado simply did not have enough places to get help for those young people. So they decided to come up with a solution of their own. Here's Anusha Roy.
We're failing our children.
Stephanie Camacho started seeing so many kids come through their emergency room.
I have a child around that age as well, and it's very hard to not kind of personalize those experiences.
The kids are getting younger, and the severity of their problems are becoming more intense.
We are not Children's Hospital.
And doctors don't always know where to turn.
Where do we go? We just didn't have an answer to that.
That's because there isn't always an answer. There's a shortage of help across the board, especially for intermediate help, something in between inpatient help and therapy once a week. The kind of help that can keep a kid out of the emergency room, and why HealthOne Behavioral Health and Wellness Center started expanding those kinds of services for kids, especially after watching what was happening in the community.
The schools also are struggling to provide the supports, and they can't be the only support.
Boulder Valley School District said they were lucky enough to fill 4 open counselor spots, but that it's been a really tough market. Jeffco Schools is using COVID relief dollars to build up telehealth services, and DPS is trying to fill 4 open spots and placing interns studying to be counselors in schools in the hopes to hire them full-time down the road.
We're seeing that come up, and we really work intentionally to build even those referral pathways.
The reason that intermediate care is so lacking is because it's tricky to set up.
Highly intensive environment. You have to have different types of spaces and staffing for those kinds of programs. And the other barrier is actually insurance. So Medicaid does not pay for the partial level of care or day treatment in some circumstances.
That means some kids are treated and then they go back into the community and don't always have enough support and could end up back in the emergency room. It's also why Children's has been expanding these kinds of services as well.
Our kids do have a lot of resilience. They can actually overcome a lot of things, but we need to support them.
There's so many factors here, right? The impacts of COVID, that outpatient care isn't always close by or available. So that intermediate help, it can look like several days of therapy in a week. You're working in groups or individual settings. Both health systems said that they are working on referrals, but also that families can call them directly and that not everybody knows about this, so that they are waiting for your call.
Nusha, you've been reporting on the pediatric mental health crisis in Colorado for a couple of years now. It seems like there's such agreement that this is a big issue for our state, and it's always shocking to hear the ages of the kids involved, how young some of them are.
Yeah, I mean, Children's was saying that they're seeing more and more kids between 12 and 16 come into their emergency rooms, but that they're also seeing kids younger than 12. And the thing about that is that the younger the kids, the harder it is to actually get these resources. And it's not just that they're younger kids coming in, it's that they're coming in even sicker than what they've previously seen, which is just heartbreaking.
At the very least, it's all hands on deck now about this. Appreciate your continued work on it. Thank you, Nusha.